Hello, and welcome to NYLinks This Week for the week of August 3rd, 2020. My name is Stephen Sawicki. NYLinks This Week is a weekly series where we interview someone involved in the delivery of HIV services in the state of New York in order to learn more about who they are, where they work, and the services that are available. Our guest today is Erika Walker. Erika, we're really glad you could be here today. Let's get to it. Could you tell us the name of the organization you work for and what you do for that organization?
Yes, good afternoon. My name is Erika Walker, like Steve said, and I am the Ryan White Program Director with Hudson Headwaters Health Network.
Fantastic. How long have you been with Hudson Headwaters?
It will be 7 years this December.
Okay, so that's quite a while. Can you tell us a bit about the organization?
Sure. Hudson Headwaters Health Network is a federally qualified health center with 19 community health centers providing primary care and more to more than 5,600 square miles of the Adirondack North Country and the Glens Falls region. The network serves all of Warren County, Clinton, Essex, Hamilton, Saratoga, and Washington counties.
Okay, that's a very large area.
Yes.
So you must have multiple offices if you're covering that larger geographic area.
Yes. So regarding the HIV program, we are located now in just our West Mountain Health Center building number 2. We see patients in Queensbury, and then the only counties we do not cover for our program itself is Clinton County, but Hudson Headwaters does provide care up in Clinton County. And they're actually adding on to Franklin County. I believe in September we'll be acquiring 2 new health centers.
Wow, that's really impressive. So you mentioned HIV, and since our focus is on HIV, tell us a bit about the services available for that population. Mm-hmm.
So our HIV program currently has 130 patients, and like other Ryan White programs, we not only provide HIV primary medical care, but case management, emergency financial services, transportation assistance. We have medication assistance. We have a food pantry. We offer patient support groups, education series. And, we try to look at the whole picture of the person and really what is that person's barrier to staying in care or getting back into care. And that's where we focus our attention in trying to take away any form of those barriers. We also provide HIV rapid testing to many places in our community, such as county STI clinics, local jails, outpatient rehab facilities, local colleges, the city library. And now, since the pandemic started, we do offer HIV at-home test kits that we make available to community members as well, because we want to find those who are HIV positive and link them directly to care. We also now are offering Rapid Start medication to newly diagnosed individuals, so that's what we're really excited about. That's new for us.
So you get one of the ways you get patients is through your own testing and the community-based testing. Do you also get patients referred to you from other providers or other systems?
Yes. So sometimes if somebody is diagnosed within the hospital, the local Glens Falls Hospital, we will get a referral from them. We also do get referrals from our own providers within Hudson Headwaters. So we have quite a few providers throughout the network, and they will make a referral through our EMR system of somebody that perhaps they've just diagnosed.
And so let's say if I'm HIV positive and I live in your service area, but for whatever reason, I don't know about you and I'm getting services much farther away, and then I hear about you, can I refer myself? Can I just come over and say, hey, I'd like to switch care to you?
Absolutely. Absolutely. Because some actual patients who use Hudson Headwaters for primary care might not use it for their HIV care. They might go to Albany for care, or they might go to Plattsburgh for care, or actually some of those who live on the Vermont border go over to Burlington for care. So if they wanted someplace closer, they could absolutely give us a call or email or text.
And you ran through a long list of services. What hours are those services available?
So generally, Monday through Friday, 8 to 4. But if somebody texts us, after hours and they're really struggling, that's when we could absolutely give them a call and help out with any crisis that they might be having. And then we also have Hudson Headwaters has two urgent care facilities as well, and somebody is always on call in a local health center.
So I want to tie two things together. You talked early on about the size of Hudson Headwaters and that HIV is only available, well, I say only, but is available in a couple of the locations, but yet Hudson Headwaters has a bunch of locations. And then you also talked about you have some HIV positive folks get their primary care through you as well. So what other, how large is the services delivered that are non-HIV through Hudson Headwater?
Sure. Well, we've continued to add on frequently our services. So there's medical and non-medical, and including behavioral health. We have a dental office. We have a really robust case management health home program. We just opened a children's school-based dental program. We have imaging, nephrology, orthopedics, palliative care, rheumatology, geriatrics, vascular services, women's care, and on top of all of those, now we now offer telehealth appointments for just about all of those services. So we are pretty much all encompassing. If someone needs specialty care, we do offer quite a few of those. We also offer phlebotomy in all of our health centers as well. Okay,
great. That's fantastic. That's a lot. I want to talk a minute, just for a minute or so about data. So sure. As a medical provider, as anybody who's ever gone to the doctor is aware, there's a lot of information collected about people. It's all individualized and personalized, and it's all really done to make people healthier. What kind of data do you use to improve the health of the program you run?
So first and foremost, we are mostly looking at patients' HIV viral load and seeing where they're at when, currently. And because obviously we all know that if someone is virally undetectable and suppressed, they're not going to transmit after 6 months. They're not going to be able to transmit the virus. So that is first and foremost for all of us within the program is that viral load suppression. And we're currently, our Q2 data shows we have a 95% viral load suppression rate with our patients, which we're really proud of and happy about. And so that is okay. If someone's does have a viral load, why do they have it? What's going on in their life? And then we get right on the phone and bring them in and talk to them and see how we can get them into care, how we can fix whatever barrier they have to actually taking the medication. So, and then besides viral load is retention and care. And making sure people are on their HIV regimens.
And the viral load is important because if your viral load is undetectable, then the virus is not continuing to attack your body, but also the whole undetectable equals untransmittable piece.
Correct.
Right. The research shows that if you're undetectable, you cannot transmit the virus to anybody else at that point. So 95% is great. The 5% who aren't suppressed, do you have a handle on? I know that's one of the reasons you look at the data to try to keep figuring that out. What are some of the reasons why somebody would not be suppressed at this point in time?
So interestingly enough, the patients, I just looked at them last week and who they are and what their viral loads are actually like. And, they are certainly within the easily to get to under 200. One, though, has a very high viral load. And when I spoke to him last Thursday, I said, what are the barriers? Number one is his housing, so we're going to work on that. Number two is an incontinence problem, right? So who thought? So he doesn't want to leave the house because he has that issue. And third is he doesn't have a washer and dryer. So if a person is incontinent and they don't have the washer and dryer, they don't want to leave the house. Which we were never aware about before. So we're working on those three barriers And, you know, then at that point in time, you know, he said he's more apt to come out, to go to the doctors, to get his medication. And so it's really communicating with the patient and asking direct questions and finding out what someone's barrier is, because what we think might be, I would have never guessed those two obstacles. So it's
Right.
really great now we can work on that with him.
Right. And as your suppression, as your aggregate suppression or the total number of suppressed gets higher, the number of people who aren't suppressed gets smaller, and the reasons really become much more individualized on a person-to-person basis. So if somebody wanted to find out more about Hudson Headwaters, what would be the best way for them to do that?
The best way would definitely be for them to reach out to me, and I know you're going to bring a slide up that has my contact information, my email, and my phone number with extension. They can also call the main number at the network itself. But for me, ewalker@hhhn.org is going to be the best way to contact me on my email.
Right. So we have that slide up now, and I'll leave that up for another second or so. Let me ask: is we're kind of at the end of the interview? Is there anything else you would like to add before we close?
Well, I just want to say thank you for having me today. I think this is a great way to communicate to other programs throughout the state. And also, I want to give a shout out to my Ryan White colleagues across the state and really thank them for all the care they provide to all of our patients, not just during this pandemic and making that even a harder time to care for those patients, but just in an everyday going to work, working with those folks who are kind of hard to deal with, and it's a struggle, but know that you're not alone and that you should certainly be really proud of the work you do. And it's great to know I have other colleagues out there that are working just as hard. So kudos to all of you.
Well, thank you for that. And thank you, Erika, for taking the time to talk with us today. And please
Thank
extend
you.
our thanks to all of those at Hudson Headwaters for the work they do and for making a difference. It's really important work, and we know it's gotten much more difficult during the present times. So until next time, this is Steve Sawicki. Be signing off now, and we'll be back in another week. And here's our contact information for NYLinks. So this is how you would get hold of us. We thank all of you for joining us today. And again, thanks to Erika for being our guest. And we will return in a short period of time.